Hello, I am Dr. Sha-Rhonda Green, and on today's episode is how to find a therapist. How do you choose a therapist that aligns with you, that matches you, and that helps you navigate the challenges that you're wanting to seek help for? So there's a couple of components to that. First, there's therapeutic alliance, therapy alliance. I want to cover insurance coverage, and I also want to talk to you about verification of like benefits, and also verifying the credential of the individual that you want to partner with on your treatment journey. So by definition, therapy alliance is a collaborative relationship between you and the therapist. It's characterized by mutual respect, trust, and open communication. And a lot of research shows that a strong therapy alliance is linked to better treatment outcomes, increased client satisfaction, and also improve mental health. So, how do you establish a strong therapy alliance? Find a therapist that is compatible with your communication style. Compatible communication style is important. The second thing is be open and honest about your concerns and goals. And the third thing is establish clear boundaries and expectations. So when you're establishing clear boundaries and expectation, that typically means that you're talking about, hey, I'm coming in with this particular issue, this particular problem, this particular need, and I want to get support. This is what I want to see at the end of treatment. This is what I want to work on. Are you able to help me with that? So you go in with knowing kind of what your goals are and what your objectives are. And sometimes you just want to feel better, and that may be a goal. And when you work with your therapist, they can help you to kind of flesh that out, and so that you will know, and both of you will know, like, okay, so when we come to this certain point at treatment, this is what it looks like for me to feel better. And so you get to kind of talk through those things. Insurance coverage is important. So if you have any type of insurance, whether you have Medicaid, Medicare, Blue Cross, Blue Shield, commercial insurance, whether you have military insurance, how do you check your coverage for therapy? Typically, on the back of your insurance card, there's a number. It's an 800 number that may say behavioral health benefits or mental health benefits or member benefits or member services. You can find out about your coverage, and there might be something on the front of your insurance card that says provider or something like that, but it will have some language that says behavioral health or mental health. So you can call that number and you can find out what your copayment is, if you have co-insurance, if you have deductibles, if you have out of network benefits or in network benefits. So when you're choosing a therapist, it's important that when you look at the in network benefits, that means that a therapist is credentialed with your particular insurance panel, and you will likely only just have to pay a certain amount according to your insurance plan. But sometimes when you have an out-of-network provider, meaning that that person may be licensed and credentialed, but they may not be credentialed in network with your particular insurance. So also there's insurance claims and billing that happens. And typically when you identify a therapist that has insurance that's on your insurance panel, your insurance, they will likely have you fill out some documents, some intake paperwork, so that they can verify your insurance and verify what you have to be paid, what you will have to pay out of pocket. Sometimes that is a copayment, which is like when you go to your medical doctor, you might have whatever dollar amount that is, $30, $15, $50, whatever your insurance plan pays. And then sometimes you might have to pay a certain amount while you meet a co-insurance amount, or a out-of-pocket amount that you have to meet before the insurance will start paying toward whatever service that you're getting. And the other thing is verifying credentials. So it's important to verify a therapist's credential, because when, as therapists, as trained professionals, we have to go through a certain amount of schooling. Each type of therapist has to go through a different type of schooling and a different amount of years. And each state has a state licensing board for mental health professionals, for counselors, for psychologists, for social workers, for marriage and family therapists, for psychiatrists, for medical doctors. And that's the first place to go to verify that the therapist's credentials are active. So most times when a therapist is credentialed with an insurance company, some of that has already been done. They have been vetted in that regard. And you go to the state licensing board and look up that information. So resources for verifying state licenses. So professional organizations. For me, it's a National Association of Social Workers. There's other professional organizations that also help you to to learn about therapists. You may probably Google a therapist and find out about them. You may be following somebody on social media to kind of get a vibe about whether this person kind of matches your communication style and whether you feel like you can have a therapy alliance with the individual. The other considerations is, oh, am I going to do online therapy? Which means that if you do online therapy, it's like you're on some type of telehealth or telemental health platform where you're doing a video-based counseling. And when you are doing therapy, and you have to be physically in the state that the therapist is actually licensed in. So, for example, if you go on vacation somewhere, you're like, oh, I'm going on vacation in Florida, and your therapist is like, no, we're gonna have to reschedule this because I'm only licensed in Georgia. So those are things to consider. Also, sometimes there may be a particular specialty. There may be something like eating, substance abuse, play therapy, art therapy, grief therapy. There may be other issues that you feel like you want a specialty in, and there are clinicians, and I use that term interchangeably, clinicians, therapists, counselors, that may have some more training or some more specialty in the area that you are seeking help for. And what is your personal preference? Location, availability, communication style, other demographic things like in terms of gender, race, in terms of how this person, maybe this particular therapist, maybe your belief systems, your religious or spiritual belief systems are important screeners for you too, and for that to be a match for you to have a therapist. So, in conclusion, those are the three things that you need to look for when you're thinking about a therapist: therapy alliance, looking at the insurance company and verifying a credential. And then also, there are therapists that you will have the ability to pay out of pocket. There might be therapists that have a sliding fee scale that you may be able to have access to, and there are therapists that it's just, hey, this is what my rate is, and this is what their particular flat rate is. So I hope this video has provided you with some helpful information for you to find the right therapist that meets your needs, and that you are taking this step to get some help. And if you're ready to take the next step and schedule a therapy session, I invite you to visit my website that will allow you to find out a little bit more about me, about my training, about my specialty. I'm especially passionate and gifted and to work with Black women, particularly Black women that have issues around boundaries, issues around intersectionality and multiple roles, and also amplifying your voice. My research is in African American women and wellness, and also subjective well-being, while balancing multiple roles, and the importance of being able to amplify your voice, to be able to recognize your emotions, and to be able to speak up for yourself in spaces, and to navigate some of the trauma that you may have experienced. So I am totally committed to providing a safe space, a non-judgmental space for you to explore your concerns and work toward your goals. So I'm going to share the link in the area of this video, and if you have questions or if you have comments, please put some comments in the comment section. And if there are questions that I might be able to ask you, that I'm able to ask you, that you may be able to ask me. And also, the disclaimer is, I am providing information as a therapist, and if at any time that you are feeling overwhelmed and you feel like you are stressed out, there are resources. You need to call 911. There's a national number, 988. It's a mental health number for you to call to also access resources that you need to take care of yourself. So I hope you have an amazing day or amazing evening, whatever time that you are watching this. And I'm going to continue to post as I have promised. Have an amazing day. Take care.